Welcome to Shar Pei Voice,
where we dive into the delightful world of wrinkled faces.
This podcast comes from the European Federation of Shar Pei Clubs, where we'll explore interesting topics about our beloved breed, together with our experienced speakers.
So grab your favorite Shar Pei, settle in, and let's embark on this wrinkled adventure.
Hi everyone, welcome to the Shar Pei Voice podcast. This episode is part of the Olympic Shar Pei events, and today we have a special guest who is an expert in a unique field. Because joining us today is Suzanne. She's an experienced canine physiotherapist. We're going to talk about why physical therapy is so important, covering topics like injury prevention, laser therapy, aquatherapy, and proprioception training. And I would love to share the story of my Shar Pei Frodo. He broke his leg in an accident, and physiotherapy really helped his recovery. So, welcome Suzanne. It is a pleasure to have you on the show.
Thank you. Thank you, Brechtje. It's nice to be here.
Physiotherapy has been beneficial for people for years, and recently it is becoming more and more recognized for animals too. And can you explain what it is exactly what you do?
Well, we see a lot of dogs, different breeds. And for all dogs, it's always important that they are very good shape. And whatever they are supposed to do, it doesn't care if it's a sport dog or it's a show dog or just a house dog. Mm-hmm. But we all want them to be healthy, and we all want them to stay as long with us as possible. So for physical therapy, we use different things, and we always talk with the owner what's if there are problems or not, and what is the use of the dog, so that we can help them with their goals with the dog.
That sounds like you're really dedicated to ensuring all dogs stay healthy and happy. And it's all about ensuring their well-being and quality of life, isn't it? I mean, a happy dog definitely makes for happy owners too.
Yeah, of course. Because when they're in bad shape, the dogs, well, of course, the quality of life is not that good. Mm-hmm. And that's not what an owner wants. They all want the dog to be happy, because when the dog is happy, we can be happy.
Of course.
So that's always... as an owner, you know your dog and you see when something's wrong. But what we don't see is when something's not wrong yet, but maybe could go wrong. Mm-hmm. So that's where we come in for preventive therapy.
That makes a lot of sense. It's like being proactive rather than reactive when it comes to their health. Preventative therapy sounds like a great way to catch things early and keep our dogs in great shape.
And not all dogs have problems. Some dogs have problems, of course, or they had a surgery, and they have to get better from the surgery. But we also see a lot of young dogs, and people want to do something with the dog, and they want to know, is my dog capable of doing this? And are there things that I have to look better for, or do I have to do things not yet? Mm-hmm. Is it too heavy for my dog to, or can I do more with my dog? So those things you can always look with the owner, and that's why we see all different ages, also young dogs,
yes,
and dogs that are just started training, or dogs that the owner said, well, she's young, is it normal that she's a little bit clumsy like this, or is it abnormal? And that's where we also come in.
That sounds very familiar for sure. I mean, many people want to know about how far and how long they can safely walk their puppy, or when their dog is old enough to start hiking, coursing, agility. And I have had those questions myself too. It's so reassuring to know that there are professionals out there to provide answers and guidance on these important milestones in a dog's life. How do you approach the variety of situations you encounter with all these different dogs and different owners? I imagine it must involve a customized approach to meet each dog's needs and perhaps also the owner's capabilities.
Well, it's all custom made.
Okay.
Every dog is different. And of course you have some more protocols, but you always have to adjust it to the dog and the owner. Because sometimes you have an older person with a dog, and I can't say, well, you just go running with this dog, because somebody's not capable of that. It should be better, but not always possible. So you have to think better. Okay, what can the owner do in this case? And sometimes you have very enthusiastic owner that's doing too much with a dog. So you have to really look and make a plan for the dog. So when somebody comes in first, then we look at the dog and we hear from the owner if there are problems or not. And what do you want to do? Why are you here for a consult with us? And then we're going to see how the dog is walking, how he feels, and we're going to feel all the joints, if they move well, or could they move better. So that's what we look, and then we have the complete picture, and then we say, okay, this is your goal, this is your ask for me, and this is what we can do, this is what we find. Did we find any problems, or do we say, well, this dog is very well trained, but his muscles are pretty tightened, and it also his joints in the back are too stiff, so there's something not in balance, so you need to work on that. And that's where we go and find with the owner, okay, what is happening, what did you do, was it too tough for the dog, or is it something that is remarkable for this dog, and that you have to be aware of, that you have to check again if there may be an underlying problem. So we always go with the owner and see what the goal is and what the owner expects of you and of his dog.
Your process sounds really comprehensive and personalized. It's so great that you take the time to listen to both the dog and the owner to get a full picture of what is needed. That must be interesting to uncover the specific needs of each dog and create a plan that suits them best. Do you believe that any dog, even an older dog or those with previous health issues, can still be effectively trained and perform well? I mean, especially in competitive environments like a show or sports or whatever.
Yes, of course, it's possible. You can train every dog. And even lazy dogs, even the dogs that are too excited to do something and they do it all wrong. So they're not doing what you ask. But you can always learn a lot of things and you can always improve your dog. It's the same like with older people. And a lot of people think that, well, you're old, you can't train anymore, you can't get better anymore. But that's nonsense. You can always train. It's maybe not as good as a young person, but you can always go better. So with dogs as well, we see a lot of show dogs and breeding dogs. We see puppies, and that's always, people want to know, are they moving well? And sometimes show dogs do have a surgery on the knee, but you want them to move well when you go to show again. You don't want somebody saying, oh, he's not moving, that leg is not moving well. No, he's had a surgery there, so that's why. No, you want them to move perfectly and full optimal. So that's something you can really train and you can do with different exercises. And sometimes you also have to treat a dog to make sure that all the joints in the back and in the legs and limbs are moving well, so that they can perform better.
And what kind of training methods do you use?
We use a lot of things. We ask what the owner is already doing, and we're trying to make that. Well, we're trying to give their advice in what's doing best and what's not that good for your dog, and how to make it more difficult. So if you want to straighten your dog, then mostly we do give advice in doing balance and coordination, and exercises to improve the power, the strengthening, and it's always what the dog can do, but it can be very simple exercises like, okay, when you put your dog with the front legs on something higher, and a couch or something more stable, like a little stairs. You can put them in front a little bit higher so that you can try to get more weight on the back. So when he's too much in front, then he will take all weight on the front. But you want to train the back as well. So if you want to straighten that, then you have to let him know you do have a back and you do need to get more weight on that.
Okay.
So sometimes with a toy or with something food or anything, you can try to make sure that they go a little bit to the back and take more carriage on that. And if you do proper things like this, you can make them more aware of their body, and they will always straighten, and they will be more capable of preventing injuries as well.
So how do you guide owners on supporting their dog's training outside of your office?
Yes, always. We always ask, what do you have at home? Do you have agility things, or you don't have it? If you don't walk in the woods, I don't care, because you have things there as well. You can use cavaletti poles, horizontal, and you can always step over that. And it gives also, you train mobility and you train the straightening of the muscles. And they also have to coordinate where to put their paw, not that they fall, and that they, you also can make sure that they make bigger steps. So there's a lot of things to do, and you don't need to get special things. I'd like to always see what people have in house and what they can use to train. So it can be small things, but a pillow or a mattress or an airbed. There's so much possibilities to train.
Oh, that is what they call proprioception training, isn't it? So how do you enhance a dog's body awareness?
It's true, because you want more body awareness. What we do see is a lot of dogs also in sport that don't have any idea where their body is. So you really need to get them back to basic and let them feel where their body is and let them use their body.
And why is it so important that they know?
Yeah.
Will it prevent injuries?
Yes, they will prevent injuries, because if they don't have any awareness of their hind limbs, then they won't train them. They won't train them as much as the front limbs. And then you have a dog that's very trained on the front, and it's a very big muscles, and on the back it's just a little chicken bum. And it's not that much. So the muscles won't be trained then, and they won't be that powerful. They can't support the joints that well. So you have a bigger chance of getting injuries, and mostly also chronic injuries. So you don't want that. You want to prevent it. So when a dog knows where his paws are, where his body is, and how to use it, they can do amazing things, and they're really bodybuilders.
It is really for every dog, isn't it? It doesn't matter if your dog is doing shows or sports or a pet living in your house.
No, I have different, more breeders, and they also find it very important that their dogs are in good shape, because when you have a dog that is pregnant, you want them to be strong, and you want them to fulfill the whole pregnancy good. And you want them, after pregnancy, you want them also want them to have a good start, and not that they fall back, that they're don't have strength anymore, that they're not powerful, because that's not what you want. You want them to be strong, and you want to walk shows again, probably, and you want to breathe another time again.
Yeah, so the dog will, recover faster after the birth of the puppies.
Yes. So if you have them in good shape, and sometimes we also have dogs that got puppies, and then when the puppies are away, the owner says, "Well, I think my dog, she is a little bit clumsy. She's not that strong as she was." And we do see them as well for physiotherapy as for aqua therapy. So in the hydrotherapies, you can train a little bit faster, and it's pretty safe to train in that. So we do see them as well.
You just mentioned aquatherapy or hydrotherapy. Can you tell more about it? I mean, I can see the value of it, especially with the water supporting the dog's weight and reducing the strain on the joints.
Yes, that's true. It is supporting the joints. And when you get high water, then you have maximum support of the joints, and they still walking. They're not swimming. That's very important. Some just also use swimming, but we use hydrotherapy as a treadmill and you will put on the water as high as you want, so you can adjust everything, also the speed and the height of the water. And the dog, you can also support where necessary, but when you have high water, then you get the full support, but you also put the muscles hard to work, because they have to go through the water. So that's really powerful training, and you can see it in the dogs, because it's hard. You need to go walk in the water yourself, and then you will find out how hard it is.
Oh, definitely, yes.
Yes, but it's a really good way of training, and it's pretty safe, because you can adjust everything. It's very safe, and you can help the dog where necessary with your hands or with your voice if the owner is close by. So most dogs really like this to do, and you can see them growing.
Yes, I can imagine many dogs like the water. But I've heard from so many Shar Pei owners that their dog have a huge aversion to water. So when a dog dislikes the water, how do you manage the situation?
And sometimes it doesn't work, but in the years that I'm working, I think I can still count it on one hand that it didn't work. So that's not much. Some dogs don't love it, but they don't hate it, because, we make it, I always say, we make it a party. We try not to force the dog, but we try to invite them to walk. And if they walk, then you put on the water. And like I said, the water you can put the high water, but you can also do a little bit water, and you can let them feel it and get used to it. And then most dogs don't really hate it. Sometimes you don't get the height that you want, and it's a little bit lower, but mostly you get, also with dogs that don't like water, they will accept it.
Oh, they get used to it.
Yes.
So how many sessions in the treadmill do they need on average?
Well, that's always depending on what the problem is, but mostly we have 6 to 8 sessions at least, and with chronic problems, we do have more sessions, but that depends on the problem, and we always look with the owner how much time between the intervention is needed. Sometimes we have dogs at 5 weeks and they're getting worse, so we need to see them every 4 to 5 weeks. Mm-hmm. But we also have dogs that we see once in 3 months or once a month, and it's really different. So for hydrotherapy, we always start with every week frequency at least, and sometimes even more, because you have to train. And if you don't train every week, then you don't do nothing actually. So you need to train at least once a week, and besides that, we give the owner advice of the exercises they can do. And sometimes if dogs are not capable of doing these exercises, or the owner is not capable of doing the exercise, then we have to see them more often. But it's always for the depends on what the problem is.
Yeah, well, that makes a lot of sense, really. And, it's really wonderful to keep them fit and healthy without overloading their body, really, with too much.
Yes.
So you can keep an eye on whether the dog is doing too much or too little.
Yeah.
And you can adjust your program.
Yes, we can always adjust. And the beautiful thing of this is that you can see the dog walk, and you're doing an analyze when he's walking, and you see, he's not moving his right limb as well. So we try to make him work a little bit harder on that limb. So you can manual help, or you can do something different. Do I have to speed up the tempo, or do I have to slow down a little bit? You can really adjust almost everything, and you can see how the dog is doing. And when they get tired, sometimes owners don't see that, but when you see the dog getting tired, he's moving a little bit slower. He is more getting a little bit, onrustig. He's getting looking around, and he's not concentrated anymore.
Yeah, he's not focused anymore.
Yes. So then okay, this is the moment, and you can say to the owner, look, this is the moment where you have to pause, where you have to stop, or you have to pause, and then you have to go. After a little bit time of waiting, you have to see if you can go further or not. And that's something that owners who do sports, or dogs that are recovering from surgery, that you can see, okay, you need to look at this. This is the point where you don't have to, you have a line here. You have to wait here. So, but that's where you want to work, because you want to train, but you don't want to overtrain.
Oh, yeah, that's so important. I love that you make owners aware of what to look for.
That's the most important, because we see them once a week, or maybe often or less. But the owner sees the dog every day, and they need to see what their dog is giving for signals.
Yes, I think as owners, we all try to understand our dog signals, but to read them can be so challenging. And the assistance you offer in this is so incredibly valuable. So, we have already touched on several methods you use to support dogs' health and recovery. But I feel that there's one more important tool that we have to talk about, and that's the high-power laser. Could you tell me more about the laser, how it helps, what it does exactly?
Well, we used laser therapy with various things. We can use it with wounds. We can use it with the joints when they have arthritis. When you have an inflammation, you want to calm it down. Laser therapy can help with it.
Inflammation in the joints, or does it also work for inflammation of the skin?
Yes. Laser therapy really works well with wounds and with inflammation on the skin. I will try to explain how laser therapy works, so then you can almost use it for anything. The laser therapy it's red infrared light, and with our device you put that light in the body. The light in the body will be transformed to energy, and this energy will be used in the cells. And so the cells are working harder. So they're working harder on the process of healing. So actually doing natural healing, but speed it up. And it's getting, so it's speeding up, but it's also healing better. So like with wounds and inflammation of the skin, but also scars, old scars that are not that give not so much suppress, you can use it to make it better. And wounds that won't heal, it takes a lot of time to heal, then you can use laser therapy very well and you have very fast results.
That sounds amazing. So does it take long before you see results?
Now it wounds, it can speed up very quick. I remember I had a dog that had for a couple of months a wound of 10 centimeters. And the vet called me and he said, well, we closed it up till 1 centimeter, but the last centimeter won't close. And, we thought, what can we do? So maybe you can do something with laser therapy. And in a month, the wound was completely closed. But they were already 4 months away from when it started. So the people were really, 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 really happy.
Wow, that's it's unbelievable how that works.
Yes.
So a laser, that sounds pretty scary. I mean, does it hurt?
No, laser therapy doesn't hurt, but you have different lasers. What we use as professionals is a high power laser, and in some countries they also use low level lasers for professionals. But here we use a lot of high power laser therapy. The high power laser therapy, well, it already says it's a high power. So you always have energy, but if you stay too long on a place, it's getting warm. And we also use laser therapy for humans. And, well, if I use it on you, I can say, well, if it's too hot, you just say stop.
Yes.
But when we use it on animals, we can't do that. So we always keep moving. So it will be warm and, like people say, it feels like a warm flame and very relaxing and also immediately releasing pain and reducing pain. So with dogs, we also see that dogs will lay down and they calm when you start with the laser therapy, and they will enjoy the big word. But some owners also always say, "Oh, he's really enjoying this," and you can see that because he's calming and he's just laying down and relaxing. So the high power laser therapy that we use is really for professionals, and it's also because when you stay too long on one place, you can get burning wounds. And we also have special glasses because when you put the light in your eye, you get eye damage. So that's something you don't want. So it's not for everyone to use. You really need to know what you're doing and where you use it for. But you also have low-level lasers, and they are very good quality, but they work not as deep because they're low, so less deep, but you can use it for skin problems very well and for joints that are not too deep, so like an elbow or knee, that kind of things. You can use it, and it's safe to use for an owner because when you look in the light, you're not yet immediately blind.
So those are lasers you can purchase yourself?
Yes, yes, you can.
So is it worth it?
Yes, absolutely. Yes, we really give a lot of advice to people to buy a low-level laser for themselves. And that's when you need the laser not for just a short time to close a wound, but when you have a chronic problem. It can be in a joint, it can be a hernia, it can be problems in the back as well, because it's not getting that deep that it's really in the back, in the vertebrae, but all the structures around, they are exposed to the laser light, and they will get a better circulation and blood flow, so they will influence the underlying problem. So we recommend some owners to buy a laser themselves so that they can do it themselves, or when the dog is having problems, that they can use it. And sometimes also preventive. I have more sport dogs that owners do have a low-level laser.
Yes.
So after training, a hard training, or after an injury, but also after training, that they use it as a preventive to
So it prevents like sore muscles, or
yes, as well, because it's the blood flow and the circulation is optimized, and they help it to recover as well from a training.
Oh, that sounds good. I might use it for myself.
yes. And a lot of owners do have a laser therapy, and they use it for their back or their own shoulder or anything, and they're also very happy with it.
So the way we met years ago is because you treated my own dog, Frodo.
Yes.
Well, he's a senior now, he's 10 years old, but when you treated him, he was 6, I think, and he broke his leg.
Yeah.
So can you explain how you, you went ahead and tried to fix him? Because he had been to the vet, the broken leg was fixed, he had been in a cast, he had a brace.
Yes.
But it was very sore.
Yes, it was sore and it was arthrosis.
Yes.
And it was active. It was warm. And he did have pain.
Yes, there was a lot of inflammation and it was swollen, and the vet didn't know really what to do because he had been quiet and reduced his movements. But after a while, he got really stiff. He got fat because he didn't move anymore.
Yes.
So we needed a plan.
Yes, that's true. Well, when you came to me, then, first we had to see his back because he sometimes had a little bit problems of that. And of course, his one hind limb didn't work as it's supposed to be. So he was compensating in his back. So we tried to loosen that up. And then we had the problem with the hock. We needed to get it more at ease. The inflammation needed to go away. So we treated him with laser therapy to calm it down and to get him more in shape and try to make him stronger. We also used, the exercises, of course, but also doing aquatherapy.
Yes.
And that's with water. We tried to with lower water. We tried to get the mobility better, and with higher water, we tried to make the muscles more strong. And that's how we looked and saw how we could build with him, how he did it. And I think we treated him more often with laser therapy when he had reaction on his hock.
Yes, we started twice a week.
Yes.
And I was so amazed with the results because he came in limping in your office and we left and he was jumping around.
Yes.
Within seconds.
Yes. Laser therapy really gives immediately effect. And that's really good because that's how you break the circle.
Yeah.
And that's how you try to break the circle and move on and move to where you were. So, yes, mostly when you have arthritis that is active, then we have to use laser therapy twice a week because you need to get the joint back to an ease joint and not an active joint that is in pain and then it has an inflammation.
Mm-hmm. Yes, that is what I noticed. The results were immediate, but after 2 or 3 days, he started getting sore again.
Yes.
I had to go back to you.
Yes, laser therapy in first it works 3 to 5 days, and then you have to treat them again, and you have to treat them again, and then when it's getting better, you have to build the frequency out. You have to say, okay, then once a week, and now we try to eat it up. And that's also, each dog is different in that. So when I treat humans, I can say, okay, when you feel it again, then we have to treat again. But you can't do that with a dog. So you have to make a plan where you can make sure that you will stop the inflammation and will get back to the result. And you can't say to the dog, well, today you don't do anything. You have to lay down and just move a little bit, just bend your knee. You can't do that. No. So you have to give the owner advice, okay, keep him calm. Try to walk and see how he's reacting, and that's when you say also in 3 days. Well, now it's getting he's falling back.
Yes.
He's getting more pain. He doesn't want to walk that much. So then you have to treat again, and you have to build it up. You have to see how he's doing.
Yeah, that is a major difference between the physical therapy and the vet. I mean, our vet was amazing. He fixed the broken bone and they did so well. But their only suggestion after was, you have to reduce his movements, keep him quiet. Well, that is impossible.
Yes.
He had so much energy and he was so frustrated. He wanted to run and move. And
we do see a lot of dogs that look depressed.
Yeah.
Because they can't do what they normally do. And they have pain, they feel something, and it's not like it was. So you want them to move better and to feel better so that the quality of life is better. And that's always a search, because sometimes you can come back to the things you did before, but sometimes not. Mm-hmm. And that's always a struggle, and you always have to see with the owner what's possible and what's not possible. But the vets, we really do need them. We can't go without them. But their treatments are different than our treatments. So what they can't do, we try to do. And if we can't help somebody because we see that the treatment isn't working how we're supposed, then we always think with the owner, okay, what's possible? Is there another treatment with another person? Do you need to go to a chiropractic? Do you need to go to an osteopath? Do you need to use acupuncture? What can help this dog? So when he first he got better, Frodo, and then you could train a little bit more with him, and he could run, and he was very happy. And then he did fall back again.
Yes, he did. Yes.
Yes. So then we needed to look, okay, why is he falling back, and what can we do? Is this enough, or do we need to do more? So then we always look with the owner, okay, what are the possibilities? What can you do? Or you can ask advice there, or maybe this is something. And also in supplements, we always give advice about supplements, mainly with problems with joints, of course, and problems with nerves. We give advice of what you can give your dog, what could help. Mm-hmm. And there are a lot of things on the market, but you need to start somewhere. And with our experience in what helps and what doesn't help, we can tell the owner, well, there's some things you could do to help, to support your dog, and to maybe recover quicker.
Oh, yeah, that is great, because there are so many things available, and sometimes, you're searching the internet, and it is really hard to tell, what should I take?
Yes, that's really difficult, and it also, and you see it with human as well, what helps for one doesn't help for everybody. True. So you have to try something, and if it doesn't work, then you have to look at it together again. Okay, what did you use? Okay, maybe you can use another thing. And so you will, that's what we do. Actually, we always look with the owner how to get the dog better and how to let him move better. And quality of life is most important for the dog.
Yes, definitely. That is what it's all about. It's all about, isn't it?
Yes, absolutely. And we see a lot of owners that have dogs and that have chronic problems, but they're so happy that we can help a little bit making quality of life better. Mm-hmm. So that's always what the owner says. Well, we're really happy that the dog is more happier, that we can do a little walk again. And that's the most enjoyable thing of my work.
For sure. Happy dog, happy owner.
Really.
Well, Susan, thank you so much. It's wonderful to learn all of this.
Yeah, thank you.
And I hope more people will realize, that these things are possible.
Yes, really. We can do a lot of things. And if the vet doesn't have any options, you really should ask if a physical therapist has options. Because we might have.
Yes, definitely. Well, thank you so much.